Imagine this. You're trying to scale a digital clinic in a system that was never designed for speed. Every step forward runs into regulation. Every new idea collides with bureaucracy. And every innovation has to fight against decades of cultural resistance. Now, add the pressure of patients who can't wait, doctors who demand trust, and investors who want results. Scaling here doesn't just mean growing fast, it means surviving in a hostile terrain. That's exactly the space where today's guest has chosen to build. Ricardo Moguel is the co founder and CEO of Clivi Health, a digital clinic transforming how Mexicans and Latin American people manage diabetes and chronic conditions. In just a few years, Clivi has raised millions of dollars, built a model of continuous patient care, and set the goal of reaching 1 million people in the next 5 years. Before Clivi, Ricardo led doctorally across Latin America and worked in the insurance industry, giving him a front row seat to the frictions and blind spots of our healthcare system. His story isn't just about technology, it's about resilience, regulation, and the human drive to change a system that resists change. Hello and welcome, Ricardo. Thank you very much for being here in this Calendar Dilemma. It's a pleasure, man.
Thank you so much, Darwin. Very excited to be here with you guys.
Thank you very much. So we have this friend in common that told me about. We were discussing the other day, right? So health tech and fintech in Latin America and whatever. And he told me Vicente Plata, who has been recently here in the Scale and Dilemma with us. He said you need to meet Ricardo Moguel. Ricardo Moguel. Am I saying it correctly?
Yeah,
Mogel or Mogel, right? Right.
yeah.
So behind scenes, I was like Muggle, like in Harry Potter or something, right? I'm a Potterhead. I'm sorry, I can't help myself. Ricardo, so I'm very glad to have you here, and I want to start with this question. Every founder has a story that explains why they're here, right? So what's yours? What moment or experience pushed Ricardo to build in healthcare?
Yeah, that's an excellent question. And to answer that,
Mhm.
I have to give a little bit of context of who I am. I
Okay,
promise not to bore to your audience. I will be very
don't
concise.
worry.
Look, man, I'm a Mexican from the south of Mexico,
Uh-huh.
raised and born in Chiapas, a small town called
Okay.
Sinaloa. As
Mhm.
many Mexicans, I was, as many Mexicans, I was raised by a single mother, and
Okay.
we come from a low income family. That's why I
Mhm.
became an entrepreneur since I have memory, not
Yeah.
because I wanted, but that's what I needed to do in order to help my home. That's something I'm super proud of today. Um, and I always like to share that there are two main circumstances who happened during my childhood who
Mhm.
define who I am today as a person and, of course, as an entrepreneur. The
Yeah.
first one is when I was 6 years old, I was diagnosed with asthma.
Mhm.
And you can probably imagine that coming from that area of Mexico where we have lack of a lot of things, inclusive
Yeah.
access to healthcare,
Yeah.
um, and we didn't have enough money. So I saw my mother suffering. I suffered to myself, and
Mhm.
I experienced what most of the people without resources in this country, and not only in this country, right across Latin America, suffers whenever they don't have access to healthcare. That's one thing. The second thing is, since I have memory, I didn't accept my circumstances. I didn't blame anybody. I just
Okay.
thought like I needed to push myself very hard to change my life, and that's what I basically did. Right when I was 17 years old, I left my hometown to go to study to a business school in the north of Mexico with scholarship. Once I got there, I realized
Yeah.
the playing field was not even for me because my classmates, academically speaking, they were more advanced than me, and they were to speak a few languages. And to be honest with
Okay.
you, my lexicon in
Mm.
Spanish wasn't that
Mhm.
great. My vocabulary wasn't that great. So that's when I realized, man,
Yeah. Just to give some context for people who's watching us, the southest part of Mexico, I mean the southern part of Mexico, is like I don't know how to call this. It's like the Mexico you see in the movies, right? In the American movies. That's the Mexico you see there. It's lack of many things, and and I'm super thrilled to hear your story, because hearing this, that you are from Chiapas, which is one of the regions that has statistically more of the poverty that is in Mexico. And now what you're doing is great. So you told me that you moved to the northern part
Yeah, I
of
moved to
Mexico.
Monterrey.
Which part was it? Sorry.
Yeah,
Ah, okay.
I moved to Monterrey. I
Yeah.
started to study there. I realized the
Yeah.
playing field was not even for me. I explained why, and then it's when I realized,
Exactly.
wow, I
Uh-huh.
have to push myself 10 times harder if I want to be able to compete in the future with this type of people, right? 3 years later, I
Yeah.
was
Yeah.
in a plane flying to Canada to study. I wanted to, like,
Hmm.
get the yeah,
Broaden your
exactly. I wanted
sight.
to see the world. I wanted to
Yeah.
expand my mindset. I wanted to grow. So I went there,
Uh-huh.
and I went to a very good school, business school. But like scholarships, they mostly pay tuition fees. So the most
Yes.
relevant part about my times in Canada is that I needed to work, and I wasn't not finding
Uh-huh.
like jobs that will be consistent. I was like washing
Hmm.
dishes or shoveling snow, or uh, like helping
Yeah.
in
Yeah.
in the kitchen. Uh,
How old were you? Will
I
this
was
happen? How
19
old were
years
you?
old at the time. Yeah,
Okay.
and
Okay.
then it
Yeah.
was very difficult to,
Yeah.
because the jobs were not consistent, and it was very
Mm-hmm.
difficult to
Mm-hmm.
survive. So I saw an opportunity to build a marketplace to give residential services to people, and that's what I started doing it.
Mm-hmm.
And yeah, I built a company. I built my first company there from scratch. I scaled it
Yeah.
over, I don't know, like 70 people. We working together. I did some money.
Mm-hmm.
I realized, first time in my life that I realized, if you work hard, if you're smart, if you propose something people want, there will be money in exchange for that
Yeah.
solution, right? And that's what I did, and I was very lucky
Yeah.
because I decided to sell the company. I was very lucky because somebody bought it uh,
Mm-hmm.
before coming back to Mexico, because my goal wasn't go to Canada and become an entrepreneur and build a company.
What kind
It
of
was a
company was that?
marketplace for residential services. So
Uh-huh.
yeah,
Residential services like real
we
estate
were providing
or
any type of residential services. We started at at the winter, snowing the drywalls,
I
the
get
houses,
it.
and
Yeah,
then
yeah, yeah,
when
yeah,
the
yeah, yeah.
seasons started, like there is a lot of work to do, like painting a wall, taking care of the leaves that comes out of the trees.
Bro, that's awesome. I mean, that's awesome. You were 19 years old, you built your own company starting from scratch, and something as simple, I mean the idea, right? Not the work. I suppose that it has to be like really hard work. And that it
Yeah,
you got bought. Oh my
the
god, right?
first
That's wow.
little exit.
Wow.
That's when I realized, okay, well,
Uh-huh.
I can build things, and I'm good at selling.
Of
So
course.
and I work hard, right? So yeah, I was lucky, was able to
Yeah.
sell it,
Okay.
get back to Mexico,
Hmm.
and then, well, that was the time I was I already finished school, so that was the time for start to work. And like in my days, to be an entrepreneur in Mexico wasn't the dream. The dream was to
Uh-huh.
go to
Uh-huh.
work
To
with
get a
a
job.
suit,
Yeah.
tie, and become CEO. I mean, that was my dream: become CEO of a
Yeah.
multinational. Uh,
Bro, I feel so related about what you just said, right? I remember being 19, 21, and 21, right? And I
wow.
live in Colima. So if you probably heard about it, right? Colima, it's not even real in Mexico, they say, right? Because it's so small and whatever, right? So and that was the dream, just as you said, wearing a suit, working for a big firm or a big company or whatever, right? And then slowly moved into management, or becoming VP or something like that, right? So yeah, yeah, I feel
Yeah,
so
exactly.
related about it.
So
Yeah.
I came back to Mexico and I joined this insurance, AXA. At the time, they
Mm-hmm.
were the
Oh, of course. Yeah.
largest insurance company in the world. And then I was very lucky because they
Mm-hmm.
placed me into the healthcare business unit. And that's what I understood a lot of
Okay.
things, right? If you have access to healthcare in Mexico, it doesn't look that bad if you come from where I was coming from. So I joined.
Yeah, from Chiapas. Mhm.
I learned a bunch of stuff. When I realized I was doing good to people, I promised to myself that I will dedicate my life to help others to have access to healthcare. That's a promise that I made to myself. And I saw an opportunity, right? I saw an
Yeah.
opportunity that, okay,
Yeah.
insurance and healthcare, there is, stop, like, I don't know, my camera.
Yeah. Yeah, there you go.
Um,
Yeah, yeah, yeah.
and,
Don't
and
worry.
healthcare where the people who were working there were like they were not innovating anything, right? I
Okay.
saw a
Uh-huh.
huge opportunity that could go very far in that in specific industry, and
Mm-hmm.
that's what I did. Right, I was
Yeah.
scaling very fast in this company. When I was 23 years old, I was already sales manager, taking care of a whole zone in Mexico, and things were great. I was earning more money. I was happy because I was wearing my suit every day. I bought a dream car with the money of the exit that I was telling you. So everything was perfect. But for me, no. For me, it wasn't
Yeah.
perfect because I already was discovering the path to change my life. So I wanted to
Yeah.
make it. I wanted to go faster, and my idea was okay. Well, education closed the gap until now, until good executives and myself. If I keep educating myself,
Yeah.
I will be probably the top 1% in my country, and I can become CEO of this company. And
Yeah.
I was very lucky. I was able to get the this CONACYT scholarship. Um,
Oh,
yeah, uh,
awesome. Yeah. 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 Well, that's impressive, man. That's impressive. I mean, I'm just like, wide. My mouth is like wide open. Like, wow, it's a lot of information to process. But wow, I mean, yeah, congrats. And then
and
what
then with
happened
this, I
after
went to
this
France to do
scholarship?
my MBA. So I did my
Okay.
MBA in France. I said, okay, we'll learn their language. I will learn their from their education because my goal, I remember, was to
Uh
become
huh.
CEO of AXA in Mexico. So I will go there. So I went to
Yeah.
France,
Yeah.
and that was the very first time in my life that I didn't need to work. I only needed to focus on my studies. You know, this
Okay.
scholarship was paying for everything: housing, tuition, and
Yeah.
yeah, life. So it was like,
This thing I can be related. I always have to work, right? I've been always like working and whatever. But I suppose that would be really, really, really
yeah,
nice to live. That was
yeah.
like the dream.
So for the very first time in my life, I was like a child. You know, like just studying and being a teenager.
Yeah.
Well, not a teenager
Yeah.
anymore, but like, well, you know what I mean. It was
But allow yourself to
playful
be
and
just a
student.
student, right? To
Exactly,
focus on one
just to
thing,
enjoy.
right?
And that's what I
Yeah.
did.
Yeah. Yeah.
I
Yeah. Yeah.
was graduated top of my class. Um,
Mm?
and then when I finished my studies, I was rehired by AXA. I went to work to Spain. I was reporting to a big regional director. Then I went back.
So you were working
I was
overseas. You were
working in
working in
Spain.
Europe.
Yeah.
Okay.
At the time, there
Okay.
was a big crisis, one of the several crises they had. So people were surprised. Like
2006, 2007, something like that. I suppose, right?
2007 was one, and then but this time was around 2013 when I was working there. Um,
Yeah, I remember watching the social media and wherever with this Podemos situation and all these guys, right? That was
Yeah,
the
that was
time.
the time. Was like also the crisis of real estate. A lot of people were like
Hmm.
devaluating the houses. A lot of people had to sell their houses. Interest rate went up. People couldn't afford to keep paying their houses.
Hmm.
Anyways, so I made the dream. I was working there. Then I was hired by another insurance company, uh, AIG.
Hmm.
That's why I came back to Mexico. I started working with them, and that's when I
Yeah.
realized I was bored. I was bored, and I wasn't bringing more access to care to people, right? And that's when I decided to step out.
Yeah.
And I met the guys of a company called Dog Planner, which are Polish guys, super talented Polish
Not
people.
planner.
They built this company,
Okay.
which was
Uh
actually
huh.
getting traction in Poland. And they saw an opportunity to buy a company called Doctoralia, which a lot of probably of your audience knows. For them, Ones who don't know,
Yes, of course.
well, it's the biggest
Hmm.
marketplace in Latin America to book an appointment with a doctor, and the biggest SaaS company for doctors in whole Latin America.
Yeah, they hold this, their schedules
Exactly.
and things like that, right?
Exactly.
Like,
So
okay.
when I met them, I mean, they bought this company, which had some little operations in
Uh-huh.
Spain.
I We're talking about
That was
2000 what?
2016.
Okay. Didn't know that. I didn't know that Dr. Ale
Yeah,
wasn't
Australia was
Mexican.
built
And
by
I
was
mean,
founded by guys from Barcelona. Yeah, but they were
oh.
not able to scale, so there was acquisition. The name remained,
Mm-hmm.
and they have marketplaces in Latin America. So I saw a lot of potential. I started speaking with
Okay.
these guys. I decided when they invited me to join the founding team, I said, okay, I will join, and I joined as a CEO of
Mm-hmm.
nobody, right? To build the operations from scratch.
I was waiting CEO, and it's because your story is always like this, Ricardo, like always up, 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 and then you were like of nobody. I was, oh
Yeah,
my
yeah.
god.
Well, I
Yeah.
was, I was,
And then what
achieving my
happened?
dream finally. I
Uh-huh.
was the CEO of a multinational company
Yeah,
of
of
nobody.
course. Yeah.
Uh,
But the dreams were pretty accomplished, right? That was the thing. That was the
exactly.
goal.
But that what happened. Well, a lot of things
Yeah,
happened,
yeah.
man. Like crazy stuff. Like we built amazing operations in Mexico. We built amazing
Uh-huh.
operations in Brazil. Mexico got break. Like, we operate so good that we make break even the company in Mexico. Open operations in Colombia, then in Chile, and then 1 year later in Peru and Argentina. And in almost 5 years
Uh-huh.
operating as a group, we crossed the $100 million mark as a company. All the operations in Latin
Okay.
America by the time were cash flow positive. And during those years, I saw the
Okay.
potential of the talent that we have here, the things that we can build as Mexicans,
Yeah.
as Latinos. And I saw a big opportunity
Mm-hmm.
of actually giving access directly to people, right? And that's why in
Yeah.
2021, I spoke with the founders and I decided to step out first because, well, the team was amazing, was extraordinary, great, operating at a really
Mm-hmm.
fast speed. They needed they
Yeah.
they they needed they don't needed my help anymore. So I said, like, okay,
Okay.
my time, my health, my brain, I have to use it in another mission. And that's why I
Okay.
step out. And in 2021, I started to build Clivi, um, being extremely obsessed by two things. First, to
Mm-hmm.
create the largest platform to serve people living with chronic conditions. That's when very personal
Okay.
across Latin America.
From
Yeah,
the
I
asthma,
think we
right?
are
Yeah.
on track to build that.
Mm-hmm.
And then I wanted to show the world that people from Mexico and Latin America, we are extremely talented and we can build world-class company. Yeah.
Okay. So, Ricardo, when you first look at the Mexican healthcare and Latin American health care system, and you got Clivi in your mind and your hands, like a newborn baby, what did you see that made you think this is going to be hard, but it's going to be
Yeah,
worth it?
death rates, man. Death rates. Whenever I was like looking at, okay, what I'm going to build next, I was looking,
Uh
okay,
huh.
if I will invest 10 years of my life, it should be a mission that actually is rewarding, right? It should be hard enough. So when I started looking at
Okay.
the death rates, I realized in Mexico, 4 years ago, I didn't know this,
Mm-hmm.
but in Mexico, reason number one why women die is not breast cancer, is diabetes.
No,
Reason number one
diabetes.
why
Okay.
people will die in Mexico, and one of the main reasons people die in Latin America is heart stroke, heart attack, heart attack.
Okay.
But look at the
Yeah, man. We got those on my
whenever you look
family.
at the source of the problem, that is always correlated, or
Uh huh.
most of the time correlated with obesity or diabetes. People who develop
Yes.
hypertension and they never took care of it, and then uh, through the years just became very bad, and then they had the stroke. um,
and we are always like on top two or top three, right? In
Yeah,
obesity, right?
yeah, exactly. In
Mexicans
Mexico,
here.
70% of the people are obese or overweight, and almost 20% of the population have some type of diabetes. And we believe there's at least another 10%
Okay.
in Mexico who are undiagnosed. So it's a huge problem, right? And whenever you look
Oh.
at the across Latin America, the data or the
Mm-hmm.
data points look at the same. And then whenever you look at how we are treating these diseases is by episode. Like I'm feeling bad, I go to the doctor. Dr. Darwin
Yes.
give me a lot of
Mm-hmm.
I got a lot of recommendations. Then I go to my place for the first 2 weeks. I will actually listen to what the doctor tell me. Then I will feel slightly
Of
better,
course.
and then I won't listen anymore to what the doctor tells me.
And
So
that's it.
6 months later, 3 months later, whenever
Of
I come
course.
back to Dr. Darwin, I still in the same place what I
Mm-hmm.
or in the same place or worse from last time.
First
So it's
started.
by episodes, and it's not only in
Yeah.
Latin America. This is
Yeah.
a problem which is beyond Latin America. And a chronic condition, I had a chronic condition. So it's not for like one time or another time.
Yeah.
It's like every day you have it. So the way we were actually giving care to people, it was broken in my vision of the world. So when I saw this, it's like, okay,
Mm-hmm.
we got
Mm-hmm.
to change something here. And yeah, that's when we started to design a solution will be all the time engaging with the patient, right?
Okay, so so how this Clivi works then? I mean, is like kind of like a subscription, and you get followed by a doctor or whatever. Is not like you said. Like for example, I started feeling bad, and then I need to go to the doctor, and that's the first step, right? I need to go to the doctor. That doesn't mean in Latin American culture that I'm going to go. Actually, I'm to go to the doctor, right? I just know that I need to go, right? But then after you go and going to Clivi, what
Yeah, I
happens
mean, the first
as a
thing that,
patient?
that you should know is that we believe on making things simpler for the patient. Whenever you have a chronic condition and you experience
Okay.
it yourself or you live with somebody with this, you will see that it's very difficult. Like every day is a challenge because
Uh-huh.
whatever you do, how you eat, how you
Yes.
sleep, how you exercise or not, how you hydrate yourself will impact on your health
Yeah.
that day. So it's very complicated. So the first thing that we set as a concept is like, okay, we have to create a product which is extremely simple for patients. So rather than creating an application or something
Hmm.
which will be sophisticated, we decided to build a virtual assistant on WhatsApp. We were pioneers. 4 years
Yeah.
ago, uh, no one was doing this. So we create this virtual assistant through the
Okay.
patients were actually able to connect with doctors. Through there, they were able to make their questions. We were able to remind them when to take their medicines and so on. And then whenever they buy our services, which is a subscription based
Okay.
model, we deliver everything patients need, right? Not only the
Hmm.
virtual assistant with this tracking their health and helping them on taking better decisions every day and
Hmm.
making sure actually they are doing whatever they're supposed to do,
Yeah.
but also we give access to high specialized doctors, such as endocrinologists, for instance, access to nutritionists, psychologists. We send to the patients home, no matter where they are, the medicines. We send them their devices. We give access to the labs, the blood work that they need in order to understand where they are regarding their health. Um, and yeah, we
Yeah.
just give the whole follow up, like everything they need to just to improve their health.
Okay. So I'm hearing a lot of interesting stuff here that you, Ricardo, are saying. But for example, it doesn't matter what the project is. Even I mean, only if it is a new a breaking thing, right? Like Clivi is doing right now. But every project talks about friction at the beginning, right? Especially when they are like a new service, like I don't know, for example, Uber at the beginning or Airbnb at the beginning, whatever. Right? So Clivi is nothing like I've heard in the past. So in this area, which is healthcare, right? Have you ever found yourself like against cultural thing, a regulation thing, resistance, like what was this thing that make you believe like, oh wow, this system is tougher than I thought. You know what I mean?
Uh,
Like, have you ever encountered this situation that goes like, oh no, I don't know if we are doing things
yeah,
correctly. I don't know if
we
this is
keep
the correct
encountering
path.
this because, I mean, as you said, this model previous to us in Latin America or Mexico precisely didn't exist. So the
Hmm.
first friction that we saw is like people didn't want to buy our product because they wanted to see a doctor, right? And
Yeah.
everything that we were delivering
Cool.
was remote. So it
Hmm.
was the first probably 500 people to join Clivi. It was very hard to convince them. Almost like I give you money to actually come and buy my product. It wasn't like this, but we had
Yeah.
to do a lot of work in order to convince them to come to us. And then there is people where they didn't have an option, right? People, for instance, I remember very well, like Ciudad del Carmen, which is like a city with good level of income, so people can access to healthcare. But there is no actually at the time when we were operating there. Imagine there was not even an endocrinologist in the in Isla in Ciudad del Carmen. So people had
Okay.
to believe, wow, I never had an access to endocrinologist, but I know the endocrinologist will help me. And they had to believe. And then whenever they
Yeah.
saw the experience and never we saw how we were very professional, and then we were obsessed as today, right, to improve people's health. Um,
Yeah.
they just keep going with us, and these patients are the ones who actually give us another patients, and that's how we started to grow at the very beginning, right? Of course, 4 years later, it's a little bit easier to sell, but it's still a friction,
Uh-huh.
right? It's still a friction
Yeah.
because people believe that they need to see the doctor face to face. And whenever you talk about cardiometabolic diseases, not necessarily.
Wait, Ricardo. Ricardo. Wait. It's because we're having some connection issues. Let me check one thing, please. So tell me, Ricardo, about this friction that every single project that has like a new and disrupting service um encounters. What was the friction that you run into?
I mean, yeah, as you said, like every project that I have joined, I mean, especially when you're building something from scratch that didn't exist in the past, there is
Exactly.
friction,
Hmm.
right? And regarding Clivi was actually people to trust in our
Yeah,
solution.
yeah. It's like
Is like in the last 35 years, people have been treating their disease by episodes. So basically, I will go to see a doctor, see what they tell me, and that's the way things work,
mhm.
right? So at the very beginning, we it was very difficult for us to actually bring patients to Clivi because there's like, okay, but what is a doctor? It's okay, you don't need to see a doctor. You will go to the
Yes,
lab,
yes.
you will do the blood work, and like this, the doctor will understand your health situation. And that was very difficult. Like, probably the first, I don't know, 100, 200, 500 patients that we had, it was almost like begging
Yeah,
them to join the
yeah,
solution. Once they join, they we were from day one. We've been extremely obsessed by improving people's health.
yeah,
So whenever they saw improvement that they never got in the past, they were the first ones to actually refer other patients, right?
yeah.
And I mean, still nowadays, even though we've been growing very fast,
Hmm.
there is still patients that they don't believe that you can treat them at a distance.
How did you manage that trust issue, right? Like that trusting issue, because of course what you're saying makes complete sense until the point that I've had CEOs in these podcasts and they always go with you need to first start with clients, right? And it makes complete sense. But now that you say like, okay, we had an idea and then we needed to figure it out how people is going to trust our business model and whatever, right? How did you overcome that challenge? I mean, I'm still wondering, what did you do to get your first client?
Yeah, and those CEOs who has been in your
Hmm.
podcast, yeah, I do agree with
Yeah.
them. I always say something which I hope helps to your audience, but sales fix everything. If
Who's-
you're not able to bring customers, in our case,
Mm-hmm.
patients, you are there from day
Yeah.
one. Um, well, we were very persistent.
Mhm.
We were very persistent. I think we are extraordinary at
Yeah.
selling. Um, but what we realized in this journey was that we had to make something which is feasible, which patient can touch and see, and and remote, right? Virtual.
Yeah.
So uh, we started to integrate to our solution physical aspects. For instance, okay, you join Clivi, and I will deliver to you the labs that you need. Okay, well, that's something from the physical world. I actually will. That's what I'm paying, right? I will see somebody doing this for me. I will add your medicines, and I will add your glucometer, your scale. I will. So okay, well, there is some value that I'm buying, like physical, and then excel at our appointments, the quality of the doctors, the rapport that they have with the
Like you
patients.
can make a single
Uh,
mistake, right? You're not allowed.
we
Yeah.
cannot,
Wow.
we cannot. Patients will leave if we make a mistake at the very beginning.
And
So
but that's like
uh,
really heavy. I mean, speaking about at an emotional level, right? When everything needs to be perfect, how do you when the environment is this kind of tough? Your team is all you have, I guess. I mean, you are after customers and whatever, but your team is like, like your oxygen, right? These kind of things. And how do you keep your team motivated when the external world felt stacked against you?
yeah, I would say it's extremely important, right, to keep team motivated in order to be
Hmm.
successful. But I would say two things. We were designed by purpose. We were designed to follow a mission that actually
Yeah.
matters, right? We want to treat people with chronic conditions like diabetes, obesity, uh, and we are obsessed about improving people's health. And like something we do at Clivi, the medical team is reporting to nobody but the chief medical officer.
Okay.
So they have their own decisions, and they always are an advocate for the patient. So we truly believe on this at the
Yeah.
company. We truly believe on people's health. We truly believe on delivering the best care, and there is always the doctors which are will be fighting on behalf of the patient. That actually assures that every decision that we take, patient is first, and it should be. In these 4 years, patient has been always or central
Yeah.
thing. Um, with that, you don't have to actually say it to the people. They will live it, they will see it, and they will see that actually your mission is true.
Mhm.
So first is that we have really this mission that actually
Yeah.
matters, right?
Yeah. Yeah.
Improve.
When
And
sorry, of course, go ahead.
with this, if you are consistent, what your mission is, and you're very consistent, people will be very motivated to join. I would say uh, 99% of the people who have joined Clivi,
Hmm.
one of the main reasons why they join is for the mission we are pursuing. And they have at home somebody living with diabetes, somebody at home who have died because of diabetes. They experience some form of obesity, overweight, or some of the family members. So they're very close by the problem, right?
Yeah. Yeah. I get it. Yeah.
Very motivated, incentivized to fight a good mission.
Yeah, your words make total sense, right? Like when you are faithful to your vision, people can tell. People can tell. And if not, if you are after money, and that's it, right? Because at the end of the day, this is a business, of course. But if that is your only purpose, people can tell, and they know that you're full of it, and they just don't show to their medical appointments, I guess, right? So once you pass survival mode, right, like convincing people and getting your first 100 customers or whatever, what levers allow you to actually scale the product, the company? And was it tech or probably the business model, probably the doctors, probably partnership? What was it?
Okay, first thing, we are always on survival mode.
Oh,
We are not thinking in years. We are thinking in months. We are thinking, okay, how things should look at the next 12, 18
okay.
months. Uh, We are not thinking in quarters. We are thinking in months.
Okay.
Okay, and then we are not thinking in months. We are thinking in days, right? Like, how is the result
Hmm.
today? This is the way we work. And that's what we believe. Like, we are every day playing to
Yeah.
survive, and this is mentality we've been keeping fresh during the last 4 years. But then replying to your question, at the very beginning, was to be obsessed by sales.
Okay.
Having MVP that works,
Hmm.
basically improve people's
Hmm.
life, but bringing people as efficient as we could.
Okay.
And a lot of points were there, and we were obsessed by bringing as many patients as we could with good unit economics. And today, it's not only sales because we keep this obsession to be extremely good at selling, uh, but also the product, right? How we enhance our product with
Hmm.
AI. We've been using lately a lot of AI, and people don't care I mean, patients don't care if you use AI or
Hmm.
not, as long as you are giving to them the right recommendations. You are actually doing intervention whenever you have to do intervention in order for them to start improving their health. So it's more like currently it's more product. We've been reinforcing a lot of engineering team, um, because that consistent experience, that experience that you give to your patients, which in the very end is like black or
Hmm.
white, they improve their health or
Yeah.
not. That's how they are going to stay with you, and that's mean growth, and that's how many patients actually they are going to bring to this journey
Yeah.
with them. That's actually growth. So yeah, um, we believe in a subscription business model in consumer. There is only two things that
Hmm.
matters. One is sales, and the other one is
Of
retention.
course. Of
Right?
course. Yes.
People will retain if you are
Mhm.
improving their lives. If not, no matter how cool you are, they will
Of
go away.
course.
And investors will care about your company only if you are actually very good at growing, which is you need to sell and
Yeah.
retain. Yeah.
Yeah. Yeah. Yeah. So looking back, what would you do differently if you had to start scaling all over again?
I will be more aggressive, definitely. We took too long to be aggressive in how many sales we wanted to
Hmm.
bring. Also, we were being more aggressive in terms of other diseases to open. Uh, yeah, more aggressive uh, to the
Yeah.
market, to what we offer, to how we attract
Yeah.
patients.
Yeah. 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 So, and do you have any advice? What will be the advice you give to a founder trying to innovate it as you in another heavy industry like energy or finance or things like that? Things that are like really harsh to culturally break.
Yeah, I would say besides sales
Uh
fix
huh.
everything, which will be
Yeah.
number
Yeah.
one. I would say the job as a CEO of a company that aims to become not the best but the only one. It's first you have to find extraordinary people and give them extraordinary challenges that actually matters their time. You have to give to them outstanding co-workers,
Okay.
right? The very best, and I have to make them millionaires. This is the three jobs that we
L-
have as a
like the
CEOs.
like the proper what is this word that I'm looking for? The outcome has to be aligned, right? Like when they invest their time, right, just to work for Clivi is not like just a wage, a salary or whatever, right? It's going to fulfill in terms of what they give to the company, is what I'm understanding, right? In the long term, right?
Exactly,
Okay.
and what the company gives back to them, right? Should be a reward, and after the years that I spend in Clivi, they should be
Yeah.
wealthy. That's part of my
Okay.
job.
Okay. That's awesome. I mean, I want to invest now. Ricardo, thank you for being here. It's been wide. What a conversation we just had. I mean, it's a lot of food for thought. I don't know if you want to add anything else to this conversation, but I think that it was really building, right? Mind building.
Thank you so much. No, nothing to add. I mean, if you have diabetes or
Hmm.
obesity, reach
We
out.
will.
we are the very best on doing that, and we truly mean this. And thank you for inviting us and to let me share a few stories with you.
Those were amazing. Thank you for being here, Ricardo. Thank you. Bye bye. Scaling in healthcare is never just about technology or founding. It's about trust, culture, and the human will to keep pushing forward in terrain that feels almost impossible. Ricardo's journey with Clivi shows us that when the environment is hostile, the only thing holding you up is your team. But scaling fast brings its own question. What happens to culture under pressure? Does it survive? Does it transform? Or does it get lost along the way? That's exactly where we are headed in our next episode. Culture under scale pressure, a conversation about what happens inside teams when growth accelerates faster than anyone expected. See you in the next episode.